I'm Craig Cohn, the Chief Real Estate Development Officer for Vail Health, and I'm standing in front of the Precourt Healing Center in Edwards, Colorado. This is a one-of-a-kind facility and the only facility between Denver and Grand Junction, Colorado that serves an inpatient behavioral health population. The three-story building is comprised of ambulance access and intake, as well as dietary services on the first floor. The second floor is dedicated to our adolescent population, and the mirror image of that floor on the third level is dedicated to the adult population. Let's take a look inside. We're standing in the lobby. This lobby helps perform another important function. When we have patients upstairs, having the opportunity to visit with friends and family is an important component to their stay here. Here in the lobby is where friends, family, loved ones can check in. They'll be met by security and reception. As you can see, or will see in a few months, there's a hospitality type feel to these spaces. And from here is where family members and friends can go upstairs for visitation hours in dedicated visitation spaces outside of those private patient rooms to spend time with friends and family. I'm standing in the Sally Port. This is where the intake process for a patient begins. A Sally Port is a large garage. It is an area where a patient can be brought into the facility securely, safely, and very privately. The garage door will close before any doors open on the authorized vehicle or ambulance that's brought the patient in. And this is where that patient's intake process will begin. We're standing on the second floor, which is a 14-patient adolescent floor. Upstairs on the third floor is the mirror image of this layout, but dedicated to our adult population. I'd like to point out a few things to this facility, both on the second floor and the third floor, that are unique in the environment. Over my left shoulder is a gym. There's a gym on each floor dedicated to the patients that will reside on that floor. Behind me is a beautiful day room. It's got south-facing views, and it opens up to a large outdoor terrace. The terrace is safe and secure, but it does give our patients the ability to get out in the fresh air and move around on a daily basis. Immediately to my right is the dining room. Both here on the second floor and upstairs on the third floor, these dining rooms access the outdoor spaces and are furnished for family-style dining to encourage our patients to spend time with each other. We're standing in kind of a free-flow hangout type area where patients can socialize with each other or just get a break in the day between their program time. And the layout of both floors of the building enable our staff to keep eyes on patients to make sure that everyone is getting the support they need throughout their day. Let's take a look at one of our single occupancy patient rooms. We're very proud of how this design came out. This is a very unique environment for behavioral health inpatients. These are single occupancy rooms. Every room has its own ensuite bath. You can see behind me, not only are these windows extremely safe and private with integrated window shades, but we're standing in a 10-foot tall ceiling space. Everything that went into the design of the furniture, both in the bedroom and the fixtures and finishes in the bathroom, are designed to not only be beautiful and durable, but to put safety and patient privacy above all other things. While we've been working on the design and construction of the overall behavioral health campus for several years, design, construction, entitlements, all of that type of work, one great resource that we have here that I feel was very unique in the design and construction process is to have our clinical partners be part of that design process to ensure that what we're building is safe, clinically sound, secure, and cutting edge. With that, I'd love for my partners to speak a little bit about what it is they do in part of the design process.
I'm Ben Karen, I'm a psychiatrist. I started reading about the work that was being done here with the building of the Precourt Healing Center and reached out immediately to see if I could be a part of it. Luckily, I'm here now helping the team build this new facility from scratch, really. And so we're trying to identify places that we can make this the best healing center possible. This is such a wonderful valley. People here do struggle, but they shouldn't have to do it alone or have to drive multiple hours to get the help that they need.
Colleen?
I'm Kylene Eilenfeld. I'm the Director of Behavioral Health Nursing, and this is a unique opportunity to bring my inpatient behavioral health experience to create a positive healing environment for the patients we serve within our community.
Thank you so much for joining us on the tour today. We look forward to showing you updates as we progress through this summer and seeing patients in the spring of 2025.